Welcome back to the Recovery Room's ABCs of Exercise After Cancer series. This is episode number 3, and I'm cancer physical therapy specialist and founder of the Recovery Room, Dr. Leslie Waldke. Please share this and our other videos both on Facebook and YouTube with your friends, family, colleagues, and cancer teams. We appreciate it. In this episode 3, we are going to be talking about people exercising during treatment. In episode 4, we will be talking about exercising in cancer survivorship. And in episode 5, we will be talking about exercise for people living with metastatic disease. For persons currently undergoing surgery, chemotherapy, immunotherapy, and/or radiation, when it comes to the ideal time to start exercising, I have a saying which is, ideally, start before you start. This means, ideally, we would love you to begin an exercise routine before you start treatment. But of course, the ideal doesn't always happen, and sometimes the ideal just isn't even possible. So my next favorite important saying is, it is never too late to start an exercise prescription, never too late, and get many positive benefits. Many people who were exercising regularly prior to their diagnosis tend to stop exercising. If this is you, unless there is some reason your physician does not want you to, which is unlikely, you should resume your exercise routine at least on some level as soon as possible. Now, there is most likely not an oncology doc on the planet that doesn't understand that exercise is both safe and beneficial for people in the middle of cancer treatment. However, unfortunately, most medical oncologists and radiation oncologists do not bring up exercise in their discussions with you. This does not mean that it is not critically important, because it is. Please bring up exercise with someone on your cancer team to see if you may have any specific limitation. And you can certainly ask to be referred to a physical therapist to help you build an exercise plan. Now, there are many benefits to exercise during treatment. One of the biggest is decreasing or minimizing the amount of cancer-related fatigue you get. As a matter of fact, the only evidence-based treatment for cancer-related fatigue is exercise. People who exercise during chemotherapy and radiation have less fatigue and less weakness, less sickness and less depression compared to those people who don't exercise during treatment. Exercise helps protect your heart from some chemo drugs and may even help protect your brain a bit. And even if you don't fly through treatment, if a bit of exercise can help make the difference between being miserable or less miserable, I highly recommend less miserable. As a matter of fact, the sicker you may get, the more you need an exercise prescription. If this is you, please have one of your cancer docs or nurses get you to a PT. People who exercise during treatment also recover much more quickly when treatment is over. You may not finish without feeling somewhat weak and beat up, but with exercise, you can minimize what you lose. So when you're done with treatment, you don't have to work to regain what you haven't lost. As you know, some cancer treatments can impact your blood counts, which includes your white cell count, your red cell count, and your platelet count. Research studies show that no matter how low your blood counts go, the exercise itself has been shown to be safe. So even people who are in the middle of a stem cell transplant and basically have no blood counts at all still get the benefits from exercise. Here's what's important for you though if you do have low counts. If your white cell count is low enough, you may be at risk of getting an infection, which of course is not good. This doesn't mean, however, that you can't exercise. It just means you need to exercise in an environment that protects you from other people's germs. If your platelets are low, we want to protect you from any potential bleeding. So in this case, we need to protect you from falling or overstraining with strenuous exercise. But this certainly doesn't mean or preclude you from taking simple walks until your platelets come back up again. And if you are anemic with a low red blood count, yes, you can still exercise. You may need to break your sessions into several shorter bouts doing less intense things. Remember, moderate exercise is anything that feels moderate to you on that particular day. Some days that may be sitting at the edge of the bed for 3 minutes, and some days it may be jogging for 3 miles. Please check out the other videos of this ABCs of Exercise After Cancer series playlist and in our Cancer and Exercise playlist to learn more. Please hang out at the end of this video to see examples of people during treatment doing moderate exercise for them. I'm Dr. Leslie Walke signing out from the recovery room. Please share these videos. Step by step, big or small, is the way to better health and strength. Exercise like your life depends on it, because it does, and treat yourself like you are the most important person on this planet, because you are. Let's talk again soon.